Call to order this special meeting on Wednesday, April 29th at 5:30 p.m. here. Carl, give me a roll call, please.
Councilmember Remley,
Here.
Ronayne,
Present.
Bundsman, Reif,
Present.
Johnson,
Here.
Bunceness,
Present.
Olson,
Present.
Rux,
Here.
Mayor Schauneman. Jeez.
It's been a year, Carl. Present, and please stand with me for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America
And to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I would ask the mayor if he has declared a quorum.
We don't.
Oh, good call.
So
Okay.
we don't have 5.
Is Mr. Lunsman available?
Trying to see if I've got his cell phone number.
If not, someone needs to drive quickly.
Getting screeched at by technology.
Yep, yeah, that's very true.
Mute, please.
Dave, will you be able to attend our meeting? We're waiting on you. How far are you from here physically? Okay. Yeah, that works short one, so.
Dave's in his cube. He'd probably be.
Hold on. Councilman Bunceness, would you be able to attend in person to make a quorum?
Dave. Mr. Bunceness.
I'll call him.
Dave.
I think we might be getting Councilman Bunceness.
Dave, can you hear us?
Yes.
We're one short here. Is it possible for you to come over to the council chambers?
Sure.
Okay.
Hey, Mayor,
Where's Dave Lunsman?
He's trying to dial into Zoom and he's having a difficult time, so we'll be able to get him the address in the meantime.
Yeah, he's trying to dial into Zoom. He isn't able to make it.
I'll have Carl send you an update.
Ron, you had something?
yeah, Mayor, you can recess the meeting until you have a quorum. At that time, you can come back in.
Okay, sounds good. Do I, at this point, we'll call for a recess and we will
We can go out and play.
resume.
We can go to the playground.
It's nice out.
No technical issues this week so far.
This is probably the closest thing to could be considered.
Go ahead. Dave. All right.
Give me a roll call vote. Or just a roll call.
Okay. Councilmember Remley,
Here.
Ronayne,
Still present.
Lunsman, Rife,
Present.
Johnson,
Here.
Bunceness,
Present.
Olson,
Present.
Rux,
Oh, here.
Mayor Shoneman.
Present.
I even got it right that time.
First order of business will be to discuss a possible first reading and passage of resolution extending emergency ordinance number 3 regarding the novel coronavirus COVID-19 public health crisis. As most of you know, we established a task force who met last night involving both civic, business, and medical leaders throughout the community. We had a very productive meeting, and I'm going to pitch this off to Josh to set us up with the resolution. Councilman Wright.
Thank you, Mayor. I'm going to start here by sharing my screen. Is that working?
Yes.
Okay. As the mayor said, we formed a task force, and I'd like to take a quick opportunity to thank all the people that were part of that. We spent a few hours last night going through this, and I really appreciate their insight. As the mayor said, we had people from both the medical community as well as the business community. From the medical community, there was Dr. Wachs, Dr. Butolf, as well as Ashley Erickson, the CEO of Sanford. And from the business community, there was David Nostrup from Levity and Thunder Road, as well as Fallon Helm from Revive Day Spa, Dwayne Sutton, who's a county commissioner as well as the owner of the Millstone, Mike Bockerney from the Aberdeen Development Corp, and Gail Oakes from the Chamber of Commerce. In addition to that, Mayor Shoneman and I were also a part of that. So again, thank you very much. We went into a lot of detail to make sure that things that were included in this ordinance ensured a responsible opening of businesses, to open up businesses as safely as we can for both the employees of those businesses as well as the customers. We talked mainly about health concerns. The mayor and I's role was mainly to ask questions and to listen to the experts in formulation of this resolution. Our goal here with this was to keep it as simple and as easy to understand as possible. We wanted to make sure that we were following not only the CDC guidelines, but the South Dakota Department of Health guidelines, as well as recommendations as set forth by our state epidemiologist and Governor Noem. There is a lot of information out there available on the CDC website. It provides a lot of guidance, and that information changes depending on the level of the threat. A lot of that information can be located on Governor Noem's on her plan via hyperlinks. If you were to look at that plan real quick, there's links there to talk about how an individual can practice good hygiene and wash their hands, and what amount should they wash their hands, when should they wash their hands. It talks about vulnerable individuals. If you're high risk, how do you determine if you're high risk? For employers, it talks about sanitation practices and how to screen employees. So if I'm a business owner, and after this tonight I have questions, I think a good place to go first would be the CDC website. There's a lot of information there. So having said that, we thought as a group it was important to set forth guidelines that could be applied to any business. We felt it was potentially not dangerous, but when you list companies, you might have an opportunity to miss a few. And a couple that were pointed out in our last ordinance that were missed. So we wanted to make sure that what we came up with could easily be applied to all businesses. Ultimately, what we came up to, this really comes down to the individual continuing to do what's safe for their situation. If you're high risk or you have concerns, you might want to continue to stay at home. This really comes down to self-responsibility and also the accountability of our local business owners to keep our community safe. Not just this task force, but I'm sure the whole city council appreciates the community's patience and their understanding that throughout this whole process. So I also had a chance to view the other ordinance brought forth it's going to be brought forth by Councilman Ronayne, and I really think we're trying to accomplish the same thing. So I would hope by the end of the evening, we'll have a resolution in place that everyone can live with. So I'm going to go into the ordinance now. If you can see that on your screen, I'm going to skip the whereases. Sorry, Ron, but we'll get into, we'll go to 2 and we'll start at 2A. The first point there was we wanted to make sure that social distancing was enforced. Enforced distancing practices of at least 6 feet between all employees and customers who are not member of the same household or dining party. And we may want to have a discussion on the dining party afterwards, just to make sure we're all on the same page onto what that means as well. 2B, provide physical barriers where practicable between employees and customers where social distancing measures are difficult to maintain. And we've all seen this in retail places with the plexiglass, whether that's Runnings or gas stations or what have you. Develop a plan to clean and disinfect high-touch areas such as tabletops, counters, desks, door handles, and equipment. Provide cloth face coverings to all employees where social distancing measures are difficult to maintain. And implement daily health screening protocol per CDC guidelines for all employees. We also think 3 is an important part of this. It says, in addition to the specific requirements listed above, all employers need to consider how best to decrease the spread of COVID-19 and lower the impact in their workplace. Businesses shall operate in a manner consistent with current CDC guidelines and any applicable state regulation or executive orders. Employers should plan to respond in a flexible way to a varying level of disease transmission in the community and be prepared to refine their business response as needed. And with that, that's pretty much the meat of this. And if there's questions, medical specific questions, I would maybe refer that to either Dr. Watt, Dr. Butoff, or Ms. Erickson.
Say, Mayor Schoeneman, this is Ron. Before we proceed to taking comment on that, could you entertain a motion and second on this resolution?
Thank you. So I will accept a motion for our first reading and passage of this resolution.
So moved.
Second.
A motion Johnson and a second from Councilman Reif. So actually from here, why don't we invite Mike Bachany, if you'd be so kind, as to come forward and maybe talk a little bit about the dynamic of the group, the conversation of the group, kind of where we ended up, and well, some of the things that we discussed as a group were.
Thank you, everybody. Just a couple comments, pretty similar to what Josh just said, but just for context, just wanted to lay out a couple things and kind of how the group went through the process last evening. But the resolution that the council has in front of you for consideration obviously comes from the task force and the recommendation of the council here. The recommended resolution follows closely with other similar communities here in South Dakota. The first thing that we want to make sure that everybody understands is everybody on the task force first priority was to consider the health, safety, and well-being of the community. That's priority number one. And really work to come to a resolution that was based on medicine and the science behind that medicine. We relied heavily on the folks from Sanford and Avera with the recommendation that you have. As a group, we feel the resolution strikes a good balance between health and safety, with businesses that are currently closed being able to begin to operate. At the council this past Monday, there were a couple of questions brought forth regarding how businesses can learn or get educated on how to best protect their employees and customers. Within the resolution, it's as Josh just read, you can see that we reference the CDC guidelines, which is what we've been directing people to from day one, and we feel that is really, really important. We feel very positive that the best source for all businesses to reference on the how-tos exist at that website. And it's very specific and it's very easy for businesses to understand. So We feel the site is easy to navigate, and the resolution that you have in front of us would be a very good option. But we stand by for any questions that anybody might have.
Has anyone got any questions for Mr. Bockerty?
I don't have a question. I just, Josh, please scroll up so you can see more of the main part of the, or scroll down, please. There you go. Thank you.
Ron, can you tell me what
Thank you, Mike.
the difference of, let's say, develop a plan as compared to implement in legal terms?
Well, there's, at some times the law actually seems to make sense, and develop, means simply that they can develop a plan in whatever formulation they want, and set out something that that would handle the cleaning and disinfecting. I think you're making the distinction there between actual implementation and what that would look like. This does not require any implementation, simply the process of putting together a plan.
And so if the CDC itself required the implementation of a plan, that would be covered in the next bullet.
Which actually it doesn't, it just recommends. So and that's the whole thing with the CDC guidelines. There is no specific saying you have to do this. They are just recommendations. And they actually are changing every day. Like yesterday came the requirement of single-use menus. So they don't even want menus like in a normal restaurant we have. Basically, they get handed a piece of paper, and at the end of each, when that customer is done, it's thrown away.
So, Ron, the way that this was
so-
intended, and the way that I read it, this gives teeth to the CDC recommendations, does it not? It says, shall
Well, direct-
operate in a manner consistent with those guidelines?
Mayor Shonman, I want to make clear, I don't believe that I'm making any kind of a legal statement here. I can tell you that what this is doing is directing that the businesses do something, and that something that they're directed to do is to develop a plan. And that's fine. If that's what the intent of the task force is and the intent of the council, if they approve this, that's fine, but it is not the same as requiring them to actually implement the plan.
I'm talking about the next, item number 3, actually, Mr. Weger. Businesses shall operate in a manner consistent with current CDC guidelines.
Right, and just so you're clear, I'm not saying that they wouldn't operate in a manner consistent with current CDC guidelines. If the guidelines only require that they develop a plan, then that's all that they would have to do under the current CD guidelines. If the task force intention is to actually have them implement the plan, then you would need to make that clear in paragraph C.
The task force, I'll speak on behalf of them unless someone has different, we would intend that it would be implemented. So that's a good point, that maybe instead of using the word develop, it says implement a plan, if we're in the legality of it.
Thank you, Ms. Erickson. I would agree, and I would actually ask for a motion to make an amendment to replace the word develop in item.
I don't think we only have a motion to bring forth what's on the agenda, which is a continuation. We haven't had a motion on this possible amendment. Is that correct?
I think we have, Clint.
Have?
That would not be correct, Councilman Rux. The councilors are free to amend the resolution as presented until it's finally, the main motion itself is approved.
I will move to replace the word in 2C, develop, with the word implement.
Can I get a second on that motion, please?
Second.
Can I get a vote? Carl, give me a roll call vote to replace the word develop with the word implement on item 2C.
Councilmember Remley.
Aye.
Ronayne.
Aye.
Lunsman.
Aye.
Rife,
Aye.
Johnson,
Aye.
Bunceness,
Aye.
Olson,
Aye.
Rux,
Aye.
Mayor Shonneman.
Aye, motion does carry. Before we get too far into the weeds on the details of this, I think maybe we get somebody from the medical community to chime in. Dr. Butoff, would you be willing to come up to the podium and tell us a little bit about your involvement in this task force and how we kind of came up with what we did?
Yes, thank you all for having me here, both at the task force meeting and tonight, as we all prepare to move from the sprint to the marathon, as it looks like it's going to be for the next 12 to 18 months at least. We're very grateful from the healthcare community that the business folks and other civic entities here have shared this burden with us. And we look forward to working with you going forward. I just want to give a little bit of how we look at this from an epidemiologic risk point of view going forward. Most of the modeling from both systems and the state for us at Aberdeen do not show that we have passed our peak. So you really have to consider everybody here still at a relatively high risk of infection. That wave is probably not going to hit us, with the exception of some unusual circumstance, until probably more like June. You know, it's going to come sooner in the Sioux Falls region, and it's upon them already. We're going to be a little bit delayed. So now is a good time for the community to kind of get used to how we might function going forward. Perhaps somewhat relaxed is laid out here from where we have been, but I would say prepared to adjust rapidly as needed. The risks are going to come not only with an additional wave in June, however muted that might now be, but there's also going to be a risk of ongoing hotspots here and there. And I think we have to be prepared for that. We're all grateful that we perhaps pushed the curve off so that we're not going to overwhelm our healthcare system. We just need to stay cognizant of that and situationally aware so that we don't trip up with a larger outbreak that might push us back to that brink. Likewise, I would like to point out in the governor's plan on page 3 of the Back to Normal plan issued yesterday, it's very nicely laid out there what criteria one should be looking for. And as you reference in the paragraph just before going into some of the specifics, this is based on the current risk. And that current risk can change very quickly. There is some nice language here on that page 3 about the role of the South Dakota Department of Health. And I can't speak to, I'm not here to speak on behalf of Brown County or the state. So that's something you have to kind of keep in mind. And I think a high level of engagement there on new and emerging hotspots, or what we're thinking of as smoldering hotspots around the state, would be important to have. I think if we're cognizant of that, and I've heard this concern from both providers in both systems, that yes, we want to see us, we're all tired, we all want to see our patients be able to carry on with life somewhat more normal with appropriate social distancing, et cetera, as laid out here. But to just keep in mind that we're all going to have to be very agile, very nimble here in responding to that. And to the extent that that can be built in to the way you function with all the legal restrictions, et cetera, we would just ask that you keep that in mind, and that this is not a one and done situation.
Definitely appreciate your input. It sounds as though Councilman Ronayne has a question for you.
Thank you. Actually, Doctor, if I could first ask you to just lean in a little bit so that people that are listening on at home, we rarely get anybody who's watching, but I think people are actually watching tonight.
Absolutely.
Did you have an opportunity to look at what will be the competing proposed resolution?
Yes, I did.
And would that resolution be acceptable to you as well?
Yeah, I think there are strengths in both versions. You know,
Okay.
the task force, and I was in favor of this, finding some balance between laying out, you know, a half dozen or so of these general principles that everyone should be paying attention to, but also referencing current guidelines that may be more industry specific and may change on a daily basis, as was pointed out, you know, earlier.
Absolutely. And I think one of the things that I understand you would like to see is that we revisit how we're doing with the hospitals and medical experts, and that would help us check the success of whichever ordinance or resolution, I should say, we adopt. Is that my understanding?
The hospital systems and also the state, because, you know, there are certain, not everybody has all the data from a hospital system point of view. We do talk and share, but we need kind of everybody involved in that, as pointed out in the governor's plan, so.
And I would like to join in those other comments, thanking you for sharing your expertise, because this is not stuff that we're good at. Thank you.
Thank you. And maybe speak a little bit, I guess, one of the points that we had kind of agreed upon, and I guess contributed by primarily from the healthcare providers, was the simplicity and high level of these bullet points, and then obviously dialing into the guidelines as presented by the CDC and those larger health entities, which really set the stage for what we're expected to do to be safe and precautious here. So there's, I guess, the takeaway that I had from the medical community and all people involved in the committee was the simpler and easier that the overarching guidelines that we had would make this thing easier to implement, and then would maybe more directly drive people to a source like the CDC that we specifically call out for specific guidance, rather than us getting into the weeds and saying, you have to wipe your hands 4 times an hour or whatever.
Yes, with the caveat, I guess, that, you know, we certainly want those general guidelines to be actionable, enforceable, I guess, it might be the legal term there. Not so much from what we're looking for in terms of liability from a medical point of view. We just want to be able to interrupt the process there and reduce the epidemiologic risks. So whatever language that needs to come out in those principles that allows you as a city council to have good command and control over that situation is what we would be looking for.
Right. And yeah, I would like to point out that one of the reason why we've had 3 of these ordinances in the first place is there was a little bit of a genesis along the way, and the third one does allow us to make more immediate changes to this thing. And I think that the thinking behind that was how do we react to the conditions as they currently stand. So I think we're in a good position to be able to make changes to this as the risk increases or decreases along the way. Any other questions for the doctor? Thank you very much.
Thank you.
I'd also like to hear from Dr. Wachs. You had some interesting things to include in our meeting, if you're willing to take the podium and maybe tell a little bit about your story as well as your input here on the committee.
Thank you, Mayor. As you may have known, I also am a survivor, in a sense, of COVID-19 and had bilateral pneumonia. Not heroic in how I got it, because I was a traveler when I picked it up and not on the front lines, I guess. But it was an interesting experience because of being in healthcare and then having to deal with patients in the future and how they're going to react to myself, and also what it meant for my community. So that is just a personal experience that they go through. And I appreciate the opportunity to be able to give feedback to our ad hoc committee last evening. I concur with Dr. Butoff. You know, from a healthcare point of view, the numbers keep changing, and as our administrators can tell, we have task force meetings once a week that we keep hearing numbers, and it's like a high 5 number that we keep hearing. The numbers keep dropping, the curve is spacing out, the peaks are dropping, but it doesn't take the alarm away totally, because the seriousness of the potential illness, if you would contract it, at the wrong time in the wrong stage of health in your life. So we very much take an idea that we need to open our community, but safely do that slowly, watch what's happening. And testing is becoming much more available, and we're hopefully in time going to have that 15-minute test. Hopefully that's not too far away, right? It's coming. And when we have that, or at least a 24-hour turnaround, it helps us as physicians manage this illness much, much better than sitting in the hospital for 5 days burning up protective equipment, and then you come up with a negative test 5 days later, and the person never did have COVID. So that's going to really help us manage it. The more testing we're going to do, you might also see our numbers increase, and then you have to make a decision. Is that because we've opened up a little bit in the community, or is that we're testing more and we're seeing more positives? And part of that corollary to me then as a physician, I want to know how sick those individuals are, because if they're very, very sick, then that creates hospital load. If they're, in a sense like I was, stayed at home for a week and got well, that's an important thing because it adds to our herd immunity. So it is good to see numbers go up. It is good to see people get this disease as long as they get it and get well. That helps our everybody in the country. But at the same time, as you see numbers go up, you do need to monitor how critical that puts a strain on the hospital, and hopefully we'll see that right now. It sounds very manageable. Our hospital leaders have been telling us that we're very well prepared for that surge that's coming and the peak, because it's slowed down and the peak numbers are less. And we should have everything we need at this time. Knowing that, that's allowed us to give the input from the healthcare to say, hey, our citizens need financial help to start their businesses back up. Emotionally is a major, major strain. And as I mentioned last night, I've had 6 elderly ladies die in the last 2 weeks in nursing homes. And they've been in a nursing home for 5, 7 years, but this is the last month they've died. And they've had no family visitors. They're locked down, and they have no idea what virtual visitation means at that age. And they just basically gave up their spirit and died. I know of no one in our town that's died from COVID in a nursing home, but I feel those 6 patients that died are COVID related because of the restrictions we've had to put on them emotionally, and that's hard to see happen, and that's to me where the time is. Yeah, we're not easing anything up to nursing homes, absolutely not, but within our community, it's time to move forward emotionally. People have been locked up in South Dakota for 6 months, pretty much, unless you're a snowmobiler and a cross-country skier. But they're waiting to get out in their parks, and I fully believe that's a safe place to be. Kids need that, families need that from an emotional point of view. So that drives me to say, wow, this is a great idea that where you're at. It's safe. Healthcare systems are okay with that, and I agree with Dr. Butoff. Man, if our numbers are wrong and they start accelerating and our hospitals are getting loaded, I do feel Aberdeen people are going to want to say, let's step back and stop and shut down and go at it again 14, 21 days later. Thank you.
So one question I've got to you is, because this has been something that's somewhat difficult for me to explain to people, you said that actually increasing numbers is not a bad but a good thing in some respects.
That's my opinion. I fully believe in the herd immunity, especially for this illness. And you look at what is the example, if I'm not mistaken, is it Sweden? That's totally, approach is totally different than the rest of the whole world. And it's going to be interesting to see in a year what their outcomes are versus our outcomes. And time will tell who managed it correctly or not. But it's good to contact this if the statistics are correct, and 95 to 98% of people are going to get this, get over it without much other complications. Their immunity hopefully takes off. There will be less people then taking this to the elderly, the homebound, the nursing homes, and you will cut down the seriousness of potentially traveling with the illness.
If every person in this entire community hid for, say, 3 months, would we presumably just pick up where we left off in 3 months' time? Should the illness find its way into the carrier network of our community?
I think you'd be right back at square one again, would you not?
Yeah, I mean,
Just the way we travel.
It that if you got us out to 12 to 18 months and we had a vaccine, great. You're not going to get there. Really, you just can't do it economically.
Sure.
The pandemic in 1917, there were 6 communities nationwide that completely isolated themselves economically, and they, in retrospective research, have fared the best, but we just can't do that these days. So I think the goals are balancing all these things. You know, you've got at-risk populations in the nursing homes we're trying to protect. We're trying to protect hospital capacity. We're trying to protect the capacity of the state to respond with contact tracing. So you've got to find this sweet spot of allowing some degree of freedom and hoping to try to control it at a hotspot level versus having us all locked down and having kind of a non-specific response to trying to what might be controlled at a hotspot level.
Interesting side note to me, Mayor, is I follow the statistics of influenza very closely, and this year in particularly. And people do not like to compare these two illnesses. However, I myself think there's a very good comparison what to watch for. And the sad news of influenza, you don't hear about that in the media at all anymore. We've had nearly 200 children die in our country from influenza this year. And maybe you can count on a hand or 10 people. I just don't know the number of children that died from COVID, but it's very, very minimal. So influenza is still a very serious illness, but it just dropped off the map once we basically closed schools. So from an educational point of view in South Dakota and Aberdeen, maybe we should have our winter break from mid-January to mid-February and school a little bit longer, and we might not have to deal with influenza. It's tough, you know, so
I'll mention it to the school board.
There might be a lot of kids who want to play during the summer that aren't too happy with that.
But so the isolation is good. It has been very good for COVID and for influenza and other illnesses. And now you're starting to look, where do we head from here?
Thank you. Is there any questions for Dr. Watts? Is either a COVID patient or a physician here in Aberdeen?
Since you had the virus, what was it, 2 months ago? A little over a month ago?
Friday, March 13th.
Okay.
Friday the 13th.
Yep. How long do you think it took you to finally get back to normal health-wise yourself? Because you hear so many things, but you know you don't really.
It was a little bit. I've had influenza a few times, and that was a whole different type of illness. You got back on your feet much quicker from that, I thought. This was different because I actually had pneumonia, so I was really short of breath, tired easier, got winded easier. So that took about 2 weeks to just heal from that. And another 2 weeks, I walk on the treadmill for 5 minutes. It felt like it had been a half hour, and it'd take a half hour to recover. Now I'm back to my normal self. So it was 4 or 5 weeks. I've been back to work 3 weeks.
Okay.
And it took a good 30 days before just to get back where I wanted to be.
Just because, like I say, I don't know many people who have had it, so you don't hear the first-hand account. So
I watched way too much TV for 10 days.
but you know, I'm glad you're better.
Yeah, thank you.
So at this time, since we haven't asked anyone from the business community directly, would one of the 3 business owners that took part in our focus group like to say a few words? David Napster.
I got volunteered, I guess. David Norship, and I think it was a good working group. I think we had a good discussion, and I don't know how much more I can add, but I think it was we were trying to keep it simple but balance the two, like what the 2 doctors just said, and trying to find that sweet spot was important, and putting teeth to the CDC guidelines, like you guys were referencing earlier, I think is important, and businesses, they care about their employees, they care about their customers, they're like family members to us. So we don't want to do anything that is overly risky or putting them in jeopardy, because we need our customers, we need our employees, and we need our hospitals. Like, we need each other to get through this, and easing up at this time, I think, is a really good is reasonable at this time. And I did look at the alternative proposal, and there's a few things that I'm not too excited about in there. And I'm not going to speak for the task force, but I know we had a task force and we were pretty unified on that message, and I think that's a good place to do, and you can always tweak it in the future, but I really encourage you to support the task force since that's what you asked for Monday night, and now you have a proposal in front of you. So,
Hey, any questions for David before he takes off? Otherwise, thank you very much. So Josh, anything to add in terms of our resolution, the task force resolution? Are you still with us?
Yes, I am. I don't believe so, Travis. I think now, to me, it would make sense if maybe the other one was talked about and looked at.
Sounds good. Councilman Ronayne, are you ready to talk through the resolution that you presented and sent via email to the council members in advance of this
Absolutely.
meeting?
Would a motion to approve be appropriate at this time before I start discussing it? We have another motion on the floor.
I don't think you can do that, correct?
Talk to the.
Ron, how does that work?
Can't have two open motions on the floor, correct, Ron?
If Councilman Ronayne is wishing to just have a straight up vote on this to see whether it gets the majority approval, that would be fine, and then he could pose another motion, or if he's wanting to move to amend by replacing it with his resolution, we have two options there. One is a motion to amend with replacement, and the other would be to ask for the vote on this and to see how that comes out, and then potentially move forward the other resolution if this one is not approved.
Very well. Thank you, Councilman, for the legal advice. I would at this time move to amend the motion by substituting the entire document that is before us for what has been submitted to the council as Ronayne proposal.
Second.
Kind of motion from Ronayne and a second from Rux. Why don't you tell us a little bit about what you've got here?
Thank you very much, Mayor. And if I could ask the city attorney to share his screen with my proposed ordinance. Maybe I would, while he's bringing that up, let me preface it by saying, first of all, this is called the Ronayne proposal, but I certainly am not alone in having drafted it. I've spoken to most of my colleagues about this today. I've spoken to restaurateurs. I've spoken to members of the task force, and I've gotten some great advice, and I appreciate it. The attempt that was made in this proposal is to take what Mr. Johnson, Mr. Reif, and the mayor proposed on Monday, and quite frankly, to make it more robust, to tighten it up a little bit, but to still permit businesses to operate. And I think in some regards, we have loosened this from what was presented on Monday, but generally speaking, I think this is a tighter proposal. One of the complaints that we heard about when we passed the first ordinance trying to limit the COVID-19 virus and to cause social distancing within our community, one of the complaints we heard is the ordinance that we passed originally was so vague, telling people distance, telling people to be safe. And the complaint was, you need to give us some bright lines. And so the attempt is made in this proposed ordinance to provide those bright lines. The city attorney has us on page 2 under 2A, and I think that's a good place to start. What I really want to highlight is what the differences are tonight from what was presented by the presenters on Monday. And if you look at item A, we have made some changes there. We are still asking that there would be a minimum 6-foot space between tables, chairs, and bar stools. And of course, this would apply to all kinds of businesses, restaurants, bars, other types of businesses that have that kind of furniture for the public. And like Mr. Reif, we did broaden it by saying that the occupants of those tables and chairs could be members of the same household, and we broadened it to say, or a dining party. And by dining party, I think what that means is if a group goes out to have dinner together, this ordinance doesn't prohibit it. Now, that's not consistent with CDC guidelines, but I think the recognition from the restaurateurs that I spoke with is that it just wasn't practical. It just wasn't workable to require them to ask for IDs and addresses for groups that come in and are seated together. And so we are relying on the public to do this responsibly. And this is a trial balloon, and if it doesn't work well, we can tighten it up. If you look at B, I'm sorry, the next change is we totally eliminated the language in the last proposal that said that there could be only, that bars and restaurants could only have one person per 120 feet. And again, the advice that I was given from people that I respect is that that just wasn't workable, that it really wouldn't permit reopening of many of these restaurants. So this ordinance is broader, or this resolution, I should say, is broader than what was brought before us on Monday in that respect. Go with me to B, and we have deleted the language that said that you could only have one person per 200 square feet in indoor recreational facilities and fitness businesses. We have substituted some general language saying that they are restricted to a number of persons that can safely and reliably ensure social distancing. So we have made this a little more general, and we are again relying on these businesses to do so in a safe and reliable manner. But this is a portion of the resolution that does have force of law, and so it can be enforced if it is clearly not permitting social distancing. In C is a change that Clint Rux recommended in a document that he put together last night, in the middle of the night, and that is inserting that we are going to require hand washing at regular intervals of at least once per hour. The prior language said regular intervals, but those regular intervals could have been before and after a shift. As long as they were regular, it would have been consistent. And so I borrowed from Mr. Rux because that was good language. Likewise, in D, he added language that I have kept in this draft that says that video lottery machines need to be cleaned between customers, and then we've added the language, and at the start of business. And I think that's a good change. E was in the original proposed ordinance by Mr. Johnson. And then we go down to, as was F and G. Those are all provisions that remain unchanged. In H, this was broadened, again, per Clint Rux's recommendations and following what was done in Rapid City. Before, it merely said, as I recall, employees of hair salons, and maybe it had a couple other items, but it has been broadened to say employees of beauty and hair salons, nail salons, tattoo parlors, spas, massage studios, and barbershops wear masks which cover their nose and mouth during customer contact times. If you look at I, that provision was in the original proposal, but we have now added J, and this was again a recommendation by Mr. Rux, and that is that employees shall wear a mask which covers the face and nose when social distancing guidelines cannot be met with or a barrier to the public is not provided. J, also per Mr. Rux, equipment and maps in health, fitness, athletic, and weight training facilities must be cleaned and disinfected between each use. So we provided those bright lines. In the original proposal, there was a number 5 that allowed administration to provide an exemption to any business under certain circumstances. I have deleted that ability to obtain an exemption, so that provision no longer exists at number 5. I have added in number 5 a phrase that the city encourages grocery and retail stores to limit customers to a number of persons that can safely and reliably ensure social distancing, and where practicable, to clearly mark one-way shopping aisles and install a plexiglass or similar divider between the customer and cashier. I suspect there is not, as a council, we have received probably hundreds of emails from the public, and there have been a great number of complaints about some of our larger stores, grocery stores, lumber yards, hobby stores that are crowded with people, that people are not practicing social distancing, and to the extent we can encourage these groups to do so, that is the purpose of this provision. Finally, borrowing from the Rapid City ordinance, I've added at number 6 that the city encourages enhanced cleaning and disinfecting requirements for motel and hotel rooms. Council, these are the recommendations that I would make. I think these provide a bright line to the community. I agree with Mr. Reif that I think we're trying to accomplish the same thing, allow a opening of the city. Admittedly, this is probably more restrained, is a more conservative approach. My hope would be that we could try this, and if things go really well, we can loosen this up in time. But I would pose to you that this is a good start.
Thank you, Councilman Ronay. Does anyone have any questions about any of these particulars? There's quite a few bullet points to run through, so we appreciate you itemizing those each for us to understand.
I would offer a couple amendments.
Okay.
So, from the original proposal that Josh presented, the implement daily health screening protocol per CDC guidelines for all employees, for employees. I don't remember what subsection that is in the original proposal, but I would ask that that be added to Councilmember Ronay and Brock's and mine and Lunsman's amendment as K.
Second.
Got a motion from Bunceness and a second from Ronay to add language that's, I'm not entirely sure if I've got the specific language, but something that probably reads along the lines of implement daily health screening protocol per CDC guidelines for all employees.
That's correct.
You are perfectly correct, Mayor. I'm sorry, when I was working on my copy, I can't believe I missed that, so.
It's Clint's fault.
I'll take blame.
Carl, why don't you give us a vote on that amendment, language, section K, Ronay's version.
And so that we're clear, that is a proposed amendment to the amendment, is that correct?
To Ronay's amendment, or our amendment, yes, yes.
Mr. Mayor, may I ask a question?
Yeah. Find your way to
Is that covered under I? Businesses are encouraged to conduct daily employee screenings for illness?
Oh,
I'm not.
Are you saying the same thing or not? I'm sorry.
It is there.
So I would ask that it be I would be replaced with the language that came from the other proposal.
Okay, so I'm not sure that I've got the version. I had a version that was emailed to me.
Yeah, I am a little lost on the original version that was presented by Josh tonight, not having that copy, so.
Mr. Mayor and Councilman Bunceness, I have on the screen subsection E from the task force proposal. Is that the language that you would want to substitute for?
I don't see it.
It isn't there, Ron.
Oh, you're not seeing it?
No.
We're still seeing.
Oh, okay.
But if you have that original from the task force, that's the one we want substituted into section I of the Ronay amendment.
The language from Yeah, I'm sorry, the language from the task force at subsection E is implement daily health screening protocol per CDC guidelines for all employees. And that would be substituted for Roman or letter I, businesses are encouraged to conduct daily employee screenings for illness.
Yes.
Okay.
Thank you, Dwayne.
Yeah.
So it actually doesn't need to be amended, it's in there?
No, we're going to amend it to
The language from the task
language
force.
that's from the task force.
Yeah,
Okay.
this is better language.
It's better, that's better language.
So I've got a motion from, it was Bunceness and a second from Ronayne to replace the language with the language from section E, implement daily health screenings protocol per CDC guidelines for employees. Carl, would you give me a vote on the amendment to the amendment?
Councilmember Rux,
Aye.
Olson,
Aye.
Bunceness,
Aye.
Johnson,
Aye.
Reif,
Aye.
Lunsman,
Aye.
Ronayne,
Aye.
Remley,
Aye.
Mayor Shonneman.
Aye.
So I have another one.
Okay.
To interrupt, sorry. Under the version that you're seeing up on the screen now that says, in addition to specific requirements listed above, business shall operate in a manner consistent with CDC guidelines and any applicable state regulation or executive orders. The task force had an additional, I believe, sentence that starts, employers should plan to respond in a flexible way to varying levels of disease transmission in the community and be prepared to refine their business response plans as needed. So I would add that language to number 3 after executive orders.
Second.
Got a motion from Bunceness and a second from Rux to add the language to number 3 on Councilman Ronayne's amendment to read, employers should plan to respond in a flexible way to varying levels of disease transmission in the community and be prepared to refine their business response plans as needed. Carl, would you give me a vote on that amendment to an amendment?
Councilmember Remley,
Aye.
Ronayne,
Aye.
Lunsman,
Aye.
Reif,
Aye.
Johnson,
Aye.
Bunceness,
Aye.
Olson,
Aye.
Rux,
Aye.
Mayor Shonneman.
Aye, motion does carry. That language has been included. Is there anything else that you've got, Dave, to change your amendment?
Not at this point. Thank you.
Can I make a comment, Mayor?
Please do, Councilman Reif.
Ashley Erickson from Sanford, she has put together sort of a mixture of these two resolutions. And I don't know if now is the appropriate time to look at that, but it includes a lot of combination of the two. And I would have Ashley, if you're available, if you want to maybe walk through that a little bit, because I think a lot of the changes you're making, Dave, is similar to what she has put together.
So, Ron, just so that we're clear, in order to discuss that, would we need a motion?
Well, ordinarily we would, but the motion hasn't been specific as to the language, so I don't know that it would be helpful at this point. Mayor Shonneman, if you're willing to let Ms. Erickson offer her comments, this would be an appropriate time.
Well, why don't we take a motion and a second to replace the original version with this, and then we'll have the latitude to talk about it in the appropriate fashion?
What's this?
What's the antecedent here of this?
Yeah.
The substitute resolution
Talking-
has been amended.
Or if we're comfortable with just
About the
discussing it.
Yeah.
Are you asking about the task force being replaced with the Ronayne?
No.
Or about,
That's already on the table.
yes.
That one, Ronayne's version is currently on the table with an amendment. And then, have you seen this?
No. No, I haven't.
On my iPad, I think.
Okay. Actually, why don't we just kick it to you? We'll sort this all out once we come up with some sort of an agreement on the language therein. Ashley, can you see or hear us?
I can. And
Okay.
thank you. And Ron, maybe it helps that I'm representing the task force to help advise or make suggestions.
So I can unshare if you would
Yes.
like.
Yep, that would be great. And then Josh and Mayor, do you want me to share the updated version, which is what you just reviewed, and some of the comments of blending our task force into it?
Absolutely. And I'll share my screen right now, Ashley, if that works for you.
Yeah, you have that document.
I do have it. Yep.
Okay. So for the councilmen, basically what our physicians and Mike Bockerney from a business perspective, our goal from a task force is what was described to you is to put some meat around it, but still direct businesses to the CDC just in case you maybe miss a business and you're getting too in the weeds. But if you'd like to have a compromise of it, I pulled what you were just going over with that proposal, and we are saying the same thing. And so I think in number A, it starts out with enforcing social distancing practices at least 6 feet between all employees and customers. Again, we're trying to get away from certain businesses and try to encompass what you can within this ordinance. And then if you look at A1, 2, 3, and 4 below, I basically took your bullet points, and all of those bullet points fell within that social distancing. So we talk about limits capacity of businesses to a number of persons that can safely be reliable. I did add in, I think I added the quotation of 6 feet space. And number 2, it's maintain the 6 foot distance between table, chairs, bar stools if occupants are not members of the same household. 3 is reduces seating, just like what you guys had there with removing chairs. And then 4 is maintaining 6 foot distance between customers waiting for service or entry. The only difference I do want to outline was my suggestion, but again, it's your guys' decision. If you go back up to A, scroll up a little bit for me, Josh. There was a last sentence that stated with immediate family within the same household or dining. It sounds like you guys are comfortable with that. I only advise from the medical community is you could find yourself with a large group of friends that want to go to a bar, and now you got 15 people that maybe came together and they're dining, right? The whole intention of this and our task force comments was reopen, but how do you do this first wave of reopening while you're still trying to have social distancing? And yes, the businesses may not like that they can't get more than one person at a table if they're not immediate family members, but I think it's a good first step, and that's what the businesses are asking for. And I think in the next couple of weeks, we'll see where our cases are at, and if there is hospitalization, to then allow the council to revisit this and say, you know what, can we loosen it up and allow larger groups to get together, just like President Trump was phasing it out. So I think, Josh, you should probably add what you guys had in there so that I don't completely revise
Can I-
what you talked about.
Can I ask a question of you, Ashley?
You bet.
When you're talking about that, and I got thinking about it while you're talking about it, do we or should we add a limit of numbers to a party? Because you could come in with 20 people and say, oh, we're all family, and we all want to sit together, versus do we limit the numbers in this first version to a number in a party sitting down at a table?
So Dave, good question, but I think you guys already addressed that, because part of this ordinance, if I'm reading this correctly, you guys are actually extending section A and 7 and B of your current ordinance. And if you go back and read your current ordinance right now, section A, paragraph 6, it states, any public gathering of 10 or more people is prohibited, A, where there's not sufficient space to have physical separation of at least 6 feet between persons who are not immediate family members or member of the same household, or B, where the CDC hygiene practices to reduce the likelihood of spread of COVID-19 disease are not maintained. So when I read that, I feel like you guys in this new ordinance are extending that section, and that covers you, and that should give the businesses an understanding that there is a limitation to the number of people within that social distancing. Does that make sense, Dave?
It certainly does, and I appreciate that, the comment and the subsection. Thank you.
So knowing that, Ashley, actually we had taken, in one of the minor adjustments that we had made following our group discussion, was adding the caveat about the members of the same household or dining party from Councilman Ronayne. You believe that, considering that component from the original version, we would be safe to include that so that several people who might be friends, who might have traveled to a restaurant in the same party, could sit at the same table as one another? That was been a concern from quite a number of restaurateurs.
And I understand that if the physicians are still in the room, I might ask one of them to come up to the podium so we can hear them. But I just caution you, again, you guys can decide what you want to do and what you feel's best for this community. But when you have the term dining group, I feel like we are opening it up to allow all 15 of us on this call to get in a car and go have lunch together, which in essence is defeating the purpose of what the task force was trying to accomplish in this first wave of really, we're still saying, reopen, but reopen with the understanding we still need to do social distancing, good hand hygiene, masking, temp checks, employee screens, as we buy ourselves more time to see where this virus is going to go. I think in your second phase, over the next couple weeks, you guys could consider dining groups or opening up to larger, whether it's 10 people or 50 people. And I think the government and federal government with the CDC is going to help guide you guys with that.
Thank you, Dr. Butol.
Dr. Wachs or any physician? Tom, are you in there?
Here to talk
Yeah,
about.
I'm here, and I'm in complete agreement, Ashley. I think we do have to think of the gotchas. There are going to be groups who aren't interpreting these the correct way or just want to push the limits. And, it doesn't take many of those to stir an outbreak. One, we've all seen the reports of one or two groups that got together, and you got a very large outbreak from that. So I'm in complete agreement with trying to think through how each of these types of restrictions might, leave us open to that.
Sounds good.
So-
Your personal feeling on if people from two different households were dining at the same table, is that a risk that, I guess, at some point, I've been contacted by quite a number of restaurants and bars that have said, if we can't have any people in there, then we're not going to be able to open anyways, and it's somewhat counterproductive to the methodology of trying to open this thing in the first place. So there has to be some leniency, I would think, in terms of that.
And I would ask Fallon, Dave, or Dwayne, because last night this was the verbiage we talked through. And unless something has changed from their perspective, I would be open to that. Maybe Dwayne, since you are.
Sure. Thank you, Dr.
restaurant.
Butol.
Just a real quick comment from last night, though, Ashley. I thought we concurred that dining party was considered to be in our language. And my opinion on that as a physician is I can have 10 people over to my house from 10 different households, and we can eat at my home without being any different as an exposure rate in the community than if under 10 people go to a restaurant and gather together in a car. So a common sense approach from a health perspective, we can do the exact same thing in our community, in our households. And if we don't allow dining parties of some extent, these businesses will not open. But yet you have that same risk factor taking place in our homes, because there's no one in our city that says I can't have 10 people over at my house to gather. You know what I'm saying?
Yeah.
So I think we decided that the language dining party was acceptable.
Okay,
That
and
limitation.
again, the council that's just one person's opinion. So Dr. Wachs, I do want to ask you this question. So let's talk about, and I'm not trying to call out different industries, but let's go through a bar setting. which has dining, but yet it's a bar. So do you feel it's appropriate that we have a group of 15 people now in a bar? That's where I was trying to just be mindful for this council that every decision you make is great, but then you just have to be able to manage it on the backside and know that you just have to have some conversation with any bar, restaurant owners, etc., that it's going to be hard for them to manage it if you have some fluidness to it. Again, I appreciate the conversation. That's just my
I think the bar setting answer to that is the bar stools are 6 feet apart, and you would hope in the bars that they're going to be managed by a table setting rather than just shoulder-to-shoulder people, which absolutely would not fit with what we're talking about.
Yeah, Clint Rux.
Just a couple of things. Of course, if this is going to start getting real confusing here, if we start talking about amendment to an amendment to an amendment to a resolution. But as I'm reading A right now, you don't have family members in there. So technically, I'd have to be 6 feet away from my family members. And you would want that language put back in, correct?
A2, Clint, there's some language on family.
Oh, I see it on 2. But it says enforce social distancing measures of at least 6 feet between all employees and customers. And then we might need to change some of that language. But as far as Josh Reif goes, I haven't been able to read this whole thing yet. So, like I say, that's the thing is this is something new, and I appreciate Ashley for basically doing a mashup. And I think anyone can sit there and say, sometimes when things get put together, you do get a good outcome. But I haven't been able to read this whole thing yet. So
well, let's go through and review it right now. Clint.
Thank you.
I mean, you've seen ours and you know yours. Let's review it, and then if you're still confused at the end, I guess we could do something different. But I think it's wise for us to at least finish reviewing this as we have Ashley here and everything else.
So Josh, I would just suggest you, while we're talking, if you don't mind, add that sentence that you guys both had of the immediate family and dining group, because it sounds consistent with what the council wanted.
you could just basically take the language from 2 and
Yep.
put it up into A.
Okay.
Well, should it really be
I don't know,
part
this is-
of all 4, or
Yeah,
is it really specifically to A2?
That'll be the tough thing. Just leave it for now. Don't worry about it, Josh.
Okay.
Go through your
Yeah,
summation.
let's get through it.
So again, we walked through A. B initially with the council was scrapped, and that was the language around putting a physical barrier in place. So Councilman, if you scroll down, you had it tied in with your face masks. And if there wasn't like social distancing measures were difficult to maintain, you'd provide a face cover and or a physical barrier to the public if
Under
it's not
J.
provided to maintain it. So I just consolidated those because we're saying the same thing. And you didn't need to repeat yourself. I also think when you look at D, you had 2 separate bullet points around face covering. You called out nail salons, hair salon, tanning booths, etc. needed to wear a face mask. And then below, I think it was in a different bullet point, I think H and E, you separately said all businesses should provide cloth masks. So to me, I stripped out identifying specific businesses, because really the goal of a face covering is if you're unable in your work environment to be able to have social distancing, it's highly encouraged that you do have some sort of physical barrier or a face covering. Does that make sense?
The reason it was in there is because it was consistent with the ordinance number 3. So that's the only reason. That was just a carryover from the Rapid City.
Yeah.
But thank you.
Yeah, and I would have made that suggestion either way. It's just to clean it up. And again, trying to, look at every community, but each community I've found when I've done my research in the last 48 hours, I identifying certain businesses and then they miss one. And I'm just trying to help you guys not miss that one and just keep it global and direct businesses in their industry to go to the CDC. So if you look at number C, the first comment is what the task force recommended, which was develop, and you guys agreed to actually use the word implement, because that was our intention, the businesses need to implement a plan for cleaning and disinfecting high top areas. With your guys' additional bullet points, C1, 2, and 3, and 4 is exactly what you guys had. I did in C1, and this is just a suggestion, but when you say hand washing, now it gets a little tricky, right? If I was a business, do I have to use soap and water, or is it sanitization? Again, as we said, we're trying to think of those got you points, and so you might want to consider hand washing / hand sanitization. And then when you put regular intervals at least once per hour, I did add in there to say, or between every employee interaction with members of the public. So again, I would look to my physicians in the room. Intervals can be as frequently as any business defines it, right? But when we're in the healthcare sector, and or what I would encourage any business is after an interaction of a cashier and cash, you want to probably use hand sanitizer. Any touch of a restaurant or a plate, you want to wash your hands. And so I didn't want it to be too open-ended that, okay, I work at Starbucks, I only have to wash my hand once an hour when they've interacted with 50 people in that hour. Again, that goes towards the CDC, and the CDC is trying to promote good hand hygiene individually and to the businesses. For the health professionals in there, do you disagree with me?
I'll weigh in on that, Ashley. No, I do agree. If you look at the CDC on the subject of food handling, for instance, there have been some very nice studies showing all the different kinds of interactions that the FDA recommended for workers to go wash their hands. They did a nice study showing how often that actually happened. And the more complicated the workflow, the less likely workers were to do it. So they actually focused a little bit less on frequency and encouraged employers to focus on reducing the complexity of that workflow, because that increased the compliance with the hand washing. So that's why sometimes getting in the weeds, this can be tricky to cut it just right.
So, and just to post them, I'm not against that, but however, with hand washing, especially in some businesses, let's take a waiter or waitress who has that interaction with the customer. Typically in a food service restaurant, hand washing sinks are really located in just a kitchen. So this does kind of, or food prep areas and dishwashing areas. So this, like I say, to have that say after interaction with members of the public, so that waitress takes an order, she now interacted, or waiter, I shouldn't, takes an order. Technically, by this ordinance, they'd have to go wash their hands.
So would a grocery store cashier.
Yep.
And I don't see them leaving their post to go wash their hands each time they check somebody out.
I kind of wonder, I mean, are people going to rub their hands right off if they wash them 60 times an hour?
You know,
Well,
I can tell you.
I think the point is, just as he was indicating, is sometimes when you get too far in the weeds, and you have to put some of this ownership back to the businesses to follow those guidelines, which it's pretty clear in every industry what they should be providing for their employees. But if you want to get this far in the weeds, you are going to get caught with the general public asking these types of questions. And really, it doesn't have to be soap and water, you guys. It can be hand sanitizer that's at least 60% alcohol, and you could have those at each of your cashiers. You know, and businesses are already doing this. And so I'm confident that the businesses will figure it out. It's just more so you guys trying to decide how far in you want to get and be able to manage the questions from the public.
Clint, the ServSafe certainly has regulations on how much.
CDC guidelines and looking at it last night are sort of following, especially for food service, are sort of following what health code does, which is you need to wash your hands after, doing in between meals. The reason I went with the once per hour is more for that hostess or that cashier. It's something easy for businesses to follow. A lot of businesses, especially international chains, have already implemented hand washing. At least some have done every half hour. The reason for the once every hour is it was, I think, simpler, especially for someone in a business environment, to say every hour on the hour, go wash your hands, to break a cycle. Because in looking at a normal business routine, no matter what it is, during your busy times, even whether it's hands, and the CDC actually recommends hand washing, and then when hand washing is not available, hand sanitizing. Hand sanitizing is not known to be as effective as good hand washing practices. But that was a whole thing for the at least once per hour, because it was something easy and a standard that I think many places could sit there and say, okay, every hour we got to get this person wash their hands, to at least break some type of cycle. A lot of places are wearing gloves too, which doesn't necessarily mean that it's safer as well. But like I say, I think in some of the businesses, to say after every interaction, we will need to, if the medical professionals are fine with just doing hand sanitizer as well, if you can find it, I think that would be unacceptable, but we need to change the language in that part of it to.
So it's safe to say that if a business were to follow the CDC guidelines on hand washing, they would be satisfactorily covered?
Not everyone follows that not every member in an establishment, let's take a restaurant, needs to follow CDC guidelines because they're not personally, may not be interacting. Let's take someone who's handling money. They may not be counted in the CDC guidelines because they're not handling food, they're not handling dishes, they're basically just handling money.
So it's an oversight on the CDC's part, do you think?
Well, the CDC is following an FDA regulation, is what they're doing, is they're following a USDA and FDA regulation. Because if you're in a restaurant, you know that because that's what they teach you in class, and that's what is food code, so that they're aware of those. So it's something easy, but there are a lot of places in a business or a restaurant or any type of thing that would not fall under those guidelines. And by creating, by saying, requiring hand washing, let's take an auto dealership. Again, you have that person working behind the counter. Can you put a standard in there where, you can create a way to break a cycle to where you can maybe, and viruses, of course, can spread a little bit different than, let's say, bacteria or all that, but can you provide a way to break a cycle at some point to where it is clean, and you've done that? And like I say, hand sanitizer is effective to some extent, but, the CDC is still really ramped up on hand washing because with this virus, it's really effective.
Yeah, and I guess I think it's great to leave it in there. The question I would pose is who's monitoring this? From a medical standpoint, when we talk about cases, and there will be more cases, we know that it will be okay. It's like as we're getting more data, that will help us drive on how we continue to manage through this, right? We're all trying to figure out how to deal with a situation as it's evolving hourly. But I just would be mindful when you get that specific, is somebody going to go around and look at a list from an employer and ask them, are they washing their hands every hour? And if they're not, what will you guys do about that? So it's just those questions you have to think about. And I also think with the CDC, they do a nice job where there's the general guidelines, and even with OSHA for these businesses, there's a packet out there for them that is very specific. And so I share that, as you probably looked at it, each of you as business owners, there's enough out there where I would suggest leaning on that, but yet giving some high level to it. And I know that sounds probably not, it's too vague, right? But I would say from our end of it, and I'd ask the physicians to join in if I'm wrong, but we would be able to mitigate a situation once we started to identify if there was a hot spot. I'll just, because that word is being used. So let's say a business this was rolled out and maybe a business wasn't following it, none of you or us may know that until there's a couple cases that pop up, which then the Department of Health is doing their tracing, i.e. they're working with us as the health system to then back into us say, what is that business doing and do we need to help them in with their guidelines, and are they not following it? And then maybe they need to be forced to be shut down, and that would be the health department's stance, or we can help give them resources. So I don't, from a physician standpoint, you want to add anything to that, or if I just mambled?
So I think there are valid points being made on both sides here. You know, and historically, yeah, we've always preferred hand washing, particularly if you've got hands that are visibly soiled, right? That's where a lot of that data comes from. You're not going to get rid of visible soiling with alcohol-based gels. There's a point made here about the health code currently. I'm wondering if there's some way to incorporate both sides here of the points that are being made,
Well-
referencing the health code.
Well, South Dakota is still operating off the 1996 food code, so I don't know if I'd go that far into it. What I was more or less thinking is not maybe someone who's handling food directly, because I think there's already good measures in kitchens in place for those people. I was more of thinking of people who may not be in the food type business or may not be directly, who may not fall under those guidelines. That, you know, if someone is just a cashier or a host or a hostess, that at some point a manager or someone knows what to do. And part of the ordinances is not, yeah, we're getting too far in the weeds, but basically it's a roadmap for us to say, hey, this is an expectation that we think won't eliminate the risk, but could benefit in some way, as hopefully not allowing more spread. I mean, we're going to have it, but you know, how can we minimize things? And not only that, for the public to know that maybe there is an expectation of cleanliness. So, you know, for me, yeah, we can get too far into the weeds. And are we really going to go out and tell a business, hey, give me a list to see who you washed your hands? Probably not. But I think our business owners need to know that this is what we expect, and please follow this. And that's why I think what we're trying to achieve with a lot of things we do is to provide that guidance. And so, but like you're right, I mean, as far as health code, it doesn't cover everyone in a restaurant or any other business that may, grocery stores, et cetera. I think it's easy, you know, at a grocery store and like I say, I'm fine with hand sanitizing. You know, like I say, I'm in these types of times, and we can change that language, but how do you know, break a cycle in the virus life cycle, no matter what, to ensure?
So Ashley, Mike, would you make your way to the podium then, please? Thank you, Dr. Butol, for your continued input.
At the end of the day, I think you guys are getting close here, but just to put some clarification on this, you know, in the weeds or washing your hands, I have the CDC website here, and it clearly states that everyone should wash your hands. Every person. So it's not specific, and then it actually breaks down and gives you a lot of key things, like if you touch something at a grocery store, and it breaks it down. So I think that just goes back to what the task force was trying to accomplish with just saying follow the CDC guidelines, because
I guess I don't have a problem personally with requiring hand washing, but can we just say requires hand washing per CDC guidelines, and just to make sure that we specifically talk about hand washing? Would that satisfy everyone?
Can I just, we haven't talked about, this is not an amendable document yet, okay? So I guess what I would like to see is that we keep going through what Ashley has presented here, and then we make a decision. I'd like to see what else you have here, and then also, I don't believe I've seen anything on face masks, but I might have missed it.
It's coming up, yeah.
Yeah, so that's coming up. Thank you. And
Oh,
Mike,
okay,
thanks
there
for
it is.
that. I do want to just, again, making a suggestion. So with hand washing, I think you guys are saying the right thing. You'll come up with a good language there. But if you look at C2 and C3, I do want to just caution you. Again, the whole point is any high touch, high volume surfaces, businesses should have a plan in place. So I'll use the grocery stores as an example. They're not, staffing it, but they're at least leaving sanitization option for the general public to choose to wipe down their cart as they go forward. And so video lottery, I think if it's important that you guys have that in place, that's okay. And then the equipment for health and fitness is okay, but I just caution that now you've called out 2 businesses where the expectation is every business who has people coming in and out should be doing that. So tanning salons, if I went in a tanning bed, wouldn't you guys be requiring me to sanitize the in and out of it? I get what you guys were trying to say. Again, it's just a suggestion that sometimes when you point out specific industries, you're going to forget about one.
So, Ms. Erickson, this document essentially represents pretty much everything that was in the other
Correct. Yep.
And okay, it's
Yep. I'll keep going for you, Travis.
What's that?
I said I'll keep moving along. That was my cue. C4 is exactly what you guys had, which, and again, that's CDC guidelines. It's posting the cleaning schedule. D is where we get into cloth face coverings, and really this was encompassing the physical barrier line item from the task force, but it's melding it in. So all businesses, if you are unable to have social distancing measures in place, i.e. within 6 feet of a worker, they should have some sort of mask on and or have a physical barrier. And then lastly is what you guys actually added into your version was the E, implement daily health screening protocol per CDC guidelines. Number 3 is exactly what you guys added in, except for I do want to highlight there is one more sentence you guys didn't, and I think you might have just missed it. So you added the last sentence in of employers should plan to respond in a flexible way. But if you go forward, maybe not. I think we're good.
Yeah, I think I just left off, all employers need to consider how to best decrease the spread of COVID. I think that's really what was missing out of the last version, so I don't know if that's important to add or not, but I'm sorry, go ahead.
Nope, Mayor, Josh, basically at the end of the day for all the councilmen is we took the task force, those are like your headers of the ABCD, and we took this second proposal and I just consolidated the consistency of what bucket they would fall into. Thank you for letting me talk.
Thank you very much for presenting that, and thanks for the extra legwork on the topic. So anyone from the business community, I guess, so where we had left it off after the task force discussion was really, why not simplify this? Why not elevate the high level things? Why not force people to consider the guidance of the CDC, which is an ever-changing document, as Clint had mentioned, and is very encompassing, covers frequently asked questions for all businesses of all types, and it's much more comprehensive than we'll be able to list, and it's almost counterproductive to pull out small bits and pieces of that and then arbitrarily changing aspects of that from my vantage point, and I thought from where we were at with this. So I'm not entirely sure that I like the idea of just merging these things wholesale just to get 100% of what everyone's ideas were onto a piece of paper. I think that Mike was right in saying the CDC is offering great guidance. If we force our business community to follow that guidance, give it the tooth of law, then we can remain satisfied that as conditions change, the CDC recommendations will be the first to change because they've got the best access to the best information, the best epidemiologists, as well as people that factor in other things like human behavior and so forth. And so we're all indirectly taking our guidelines and marching orders from the CDC, whether it translates down through the Department of Health or other sources, I think it makes sense to send people directly to the source. So that's where, that's, I guess, the big takeaway that I had from the discussions in the task force, and I guess I wouldn't necessarily support just melding all of these different items and making the thing more complicated, but I do like the fact, Ashley, that you organized it for these guys, because it does make it a little bit easier to digest.
If we are back on my amendment, Mayor, I would propose an amendment to my amendment, and that is in paragraph 2A, where it says, maintains a 6-foot space between table, chairs, and bar stools if occupants are not members of the same household or dining party. I would move to insert at the end of that, after the word party, of not more than 6 persons.
Is there a second to that, to the motion from Councilman Ronayne?
Second.
A motion from Ronayne and a second from Bunceness to begin to further identify the number of parties at a table. So the language that would be added would be something along the lines of in groups of 6, not to exceed groups of 6.
Of not more than 6 persons.
Of not more than 6 persons. Carl, would you give me a vote on?
Yeah.
Oh, that's a great idea. Yeah, that's, sorry about that.
Mayor, may I ask a question?
Why don't you find your way to the podium? Wayne, I appreciate
Can I clean this before somebody sits down there again?
It's like you do that periodically.
I've done this a time or two.
Thank you, Dwayne. Sorry.
Thank you, Mayor. Just a quick question. I believe reference was made earlier that what we're dealing with tonight is an extension of your original resolution or ordinance. And I believe in the original one, don't you already address groups of 10 or more? And that language continues to follow over into what you're proposing tonight? So wouldn't that already be limited to 10?
It would be limited to 10. This would limit it to 6.
Okay.
And this is, quite honestly, this is after listening to these physicians who I have a lot of respect for their opinion.
So your original language would probably have to be amended?
No, the 10 would restrict
substitute
other,
the
would
10?
instruct, no, that would prohibit any group of more than 10, regardless of whether it's in a restaurant or bar.
Okay. So now it'll be 6 instead of 10?
6 in a restaurant or bar, 10 in a different type of group setting.
And I might break with people on this because I think if we already have, just to maintain consistency, I wouldn't see an issue if 9 people are together of either the same family or friends, and then they're 6 feet away from other people. Is basically what would have to happen with this ordinance. Like I say, we have families bigger than 6.
Members of the same household
that's
are
true.
different.
That's true. But like I said, I think, yeah, 9. I mean, I think we already cover that later on.
So
Well, I guess my argument is you've already got 10, and I'm feeling a little bit singled out and picked on here as a restaurant owner because other areas, other businesses, you can congregate up to 10, but now just because I have a restaurant, I'm limited to 6.
Other businesses have to remain 6 feet apart. And you don't have those restrictions if they're all sitting at a table. You are being singled out, Dwayne, but you're getting favorable treatment.
I'll agree to disagree on that, but I can guarantee you walk in any of the large retail stores, they are not 6 feet apart, so thank you.
I agree with that.
Excuse me, say, Carl?
Yeah.
Could you turn Len on, please? He's muted.
Len, you're still muted. You may have to touch it yourself.
Trying to unmute him, but I'm not.
You might be muted on his end. There you go.
There we go.
I apologize, I could not hear everything stated by the last gentleman, but you've went through and you've talked about various different amendments. And within both drafts, it talks about extending paragraph 6 and 7. And I really think that you should bring up paragraph 6 so everyone clearly understands what that states in addition to what you're looking at this evening, because it's quite specific language. And it was based upon ordinance number 3, paragraph 6. I think it should be pulled up, and you went through all of this time to do explanation of these other areas. You really should look at what 6 and 7 says in addition to what you're looking at this evening, so you have a comprehensive view of everything.
Ron, I'll stop sharing my screen. Can you bring that up?
Yes, I can. So this is the document. Paragraph 6.
Can you minimize that a little bit? The pictures of people on Zoom kind of cut off the ending parts of it.
I think I can.
You can move the pictures.
Yeah.
Oh, yeah,
I
you can.
can't.
Who has control of?
Can that paragraph be read, since I can't see it?
I'll read that if that's okay. Paragraph 6, in addition to the prohibitions and closures ordered in paragraphs 1 through 5 above, effective 12:01 a.m. on the day following the passage of this ordinance, any public gathering of 10 or more people is prohibited, A, where there is not sufficient space to have physical separation of at least 6 feet between persons who are not immediate family members or members of the same household, or B, where CDC hygiene practices to reduce the likelihood of spreading the COVID-19 disease are not maintained.
That language does not allow for what we're trying to put in there for dining.
Correct.
Ron, would you concur with that?
Are we talking about trying to allow more than 10 people dining, or are we talking about the 6 that was proposed by Councilman Ronayne?
I guess my question would be, does paragraph 6 allow 10 people to dine together, sitting at the same table?
Okay. Here's my position on that, is that paragraph 6 is kind of a catch-all to deal with any specific paragraphs through 1 through 5 that would not have been addressed in 1 through 5, then you would go to 6. And because 1 through 5 would deal with, one in particular deals with bars and restaurants, then I would say that paragraph 6 does not limit a public gathering to 10 or more people in a bar. 6 is a standalone on its own to address those specific issues that are gatherings that are not already dealt with in 1 through 5.
Does it require a 6 feet space between each person?
Paragraph 6 does, yes.
Unless it's addressed in 1 through 5.
Right. And
Yeah, and the resolutions that are on for discussion, both are all dealing with 1 through 5. And you're making specific exceptions and easing restrictions for 1 through 5. None of those would affect number 6, but at the same time, number 6 is not going to limit a bar or a restaurant to 10 people.
Can 6 be restated where it says it does not include 1 through 5? It does state that, doesn't it?
Yeah, it says in addition to the, it's, and again, this is my interpretation, and this is what I was intending as I drafted it, was that this was to catch those situations that aren't already covered in 1 through 5.
Okay.
So Dwayne, is 6 a reasonable number of people, or as a restaurateur, would you say that 6 is a reasonable number?
I think Councilmember Rux made a good point. If my daughter and her husband and 3 kids go out with my wife and other daughter, and I will be at 7. So we'll be in violation if the 7 of us want to go out for dinner. And I know there's a lot of families like that. You know,
Yeah.
not all families are 6 or under, so that's my concern. 10 is a more realistic number. Even if you apply the family members or immediate household, that's a more realistic number.
Yeah, I'd like to jump in, fully agree with that. There are, you know, I have a large extended family. We don't all live in the same household as is used in the terminology there. But when we go out for an event, we're going to exceed that 6. I see anecdotally a lot of examples of other families that do that. I don't think that we can pretend to know the furnishing options in every restaurant or eatery in town, and the flexing that can be done. Some of them have padded seating along a wall where you could have adequate spacing, and these would not technically be from the same household. I think this is kind of a killjoy amendment. I hate to say it's just a little too restrictive. I think 10 is consistent and it's a good number to use.
Even in the most restrictive federal documents, we didn't address smaller groups than 10. Councilman Munson.
Ron, if it's not specified in 1 through 5, does the number need to be specified?
No,
It'll be caught by paragraph 6?
no.
No.
And again, are you talking specifically about some group going to the Millstone, for example? These changes that I see to 1 through 5 that you're making as far as easing those restrictions would not limit, number 6 would not limit that group to 10 or anything, because it doesn't apply to a restaurant.
Okay, so I think that's what my point is that we would need, if the number is 10, then we would have to add the number 10 there, or someone going to the restaurant could have a party of 20.
Correct. I agree with that.
Question is what number do we find? And if we're happy with.
Well, and are we confident that the CDC itself hasn't recommended such a guideline? I know that the federal government and many other documents that I've seen have restricted groups of 10 based on various documents that I've seen recently. So I would expect that that's something.
Yeah, all I'm saying is that, I mean, we heard Ashley state basically that, you know, we shouldn't have basically just 1, I think, is what I heard, or maybe 2, and now we're going to the opposite end. I mean, she's talking about how do we control it for another 2 weeks or 3 weeks or whatever it is, and so that's just a
and
question.
further than that, I think we need to have a bright line. You know, you talk about referring everybody to the CDC. What do we expect people to do? Carry around their pocket CDC guide? They're not going to be looking at these restrictions. The public needs a bright line, and if 6 isn't the right number, pick a different number. But I think we need to have some limit on it.
And can I just clarify, you guys are speaking in general of non-immediate family members, right? So this is just dining options that 10 friends could get together and have lunch together, correct?
Yes, the language is household members, but yes, that's correct.
Okay.
Dr. Buchwald, I would imagine you've got something to add.
Yeah, it's just that, so in general, I agree with, you know, from an epidemiologic point of view, we're always going to say less is better, right? I don't have epidemiologic data, though, to say that 6 is better than 10. And I agree that most of the federal guidelines that I'm seeing and CDC references are using the number 10. Some of those are in different types of guidance documents for large events, et cetera. You've been looking at it a lot, Ashley. Am I missing anything there in your review?
No, as you guys are talking, I'm actually working to pull it up for you. So you guys
You know, I'll make the amendment to Rob's to go to 10.
Second.
So Councilman Bunceness has an amendment that would state after the end of
Dining
section
party.
A, it would say of not more than 10 persons.
Correct.
We've got a motion from Bunceness and a second from Rux. Does anyone have anything to add to that? Councilman Johnson? 10 is satisfactory?
Your family can go on. Different household.
Some of them. I have to leave a few at home. Sounds good. So then, Carl, give us a roll call vote on the amendment of 10 persons to, I guess, is it A?
6 to 10 on.
Amend.
We hadn't, okay. Yep.
We're amending the amendment to the amendment to the amendment.
Scientific, of not more than 10 persons.
Deep in the word.
Bullet A.
Councilmember Rux.
Aye.
Olson.
Aye.
Bunceness.
Aye.
Johnson.
Aye.
Rife.
Aye.
Lunsman.
Aye.
Ronayne.
No.
Remley.
Aye.
Mayor Shoneman.
Aye, motion does carry. And in looking through the remainder of these items here, I guess that's kind of where it put us.
I think we need to vote
Now we
on
need to vote
10 persons
on
now.
the amended
I thought
amendment.
that's what that was.
That was the
No,
motion.
we
amending-
amended the amendment, so now we have to vote on the amendment.
Right,
I see.
the amendment to the amendment.
So do we need a motion to do that?
It's already,
It's already
already
there.
there.
We've got a motion from Bunceness and a second from Rux to make an amendment to the amendment of not more than 10 persons to the bullet A in the resolution that we're speaking about. Carl, give us a roll call vote, please.
Councilmember Remley.
Aye.
Ronayne.
Aye.
Lunsman.
Aye.
Rife.
Aye.
Johnson.
Aye.
Bunceness.
Aye.
Olson.
Aye.
Rux.
Aye.
Mayor Shoneman.
Aye. Motion does carry. As far as the remainder of these bulleted items, does anyone else have anything? I guess that's kind of where we're at with this thing at this stage in the game, or anyone have anything to contribute to this amended motion to replace the first resolution with this? So we have a motion from Ronayne and a second from Rux to replace the recommended resolution from the task force with one that was an abridged version of the proposal from Monday. We'll take a roll call vote on that. Carl?
So we're voting on the Ronayne amendment to the,
Rec.
okay.
Pretty sure. Councilmember Remley.
Aye.
Ronayne.
Aye.
Lunsman.
Aye.
Rife.
No.
Johnson.
No.
Bunceness.
Aye.
Olson.
Aye.
Rux.
Aye.
Mayor Shoneman.
No. Motion does carry. So we're working on this at this stage in the game to add this to, or to pass this amendment at this stage in the game. So in speaking of Resolution 200407R, does anyone have any other points to make as it relates to the bullet points that have already been amended or otherwise? I'd gotten a couple of notes ahead of time. Dwayne, did you have any particular concerns with a couple of these bullet points that you wanted to address?
Were you speaking to me?
Dwayne.
Okay.
I thought I'd gotten correspondence prior about a couple of these points.
I'm sorry, Mary, I made a note here and I just have to figure out which document I was referring to. There's been a couple,
Juggling documents here
couple
tonight.
versions here tonight. And I believe it may have been on Ashley's and I don't have a copy of that. So at this point, I think either version is gonna be fine, quite honestly. I was in favor of what we put together last night or what the task force came up with. I thought it was clean and simple and and we weren't specifically naming any particular business. We were trying to keep it a more of a 30,000 foot level view of the thing and keep it more generic, but I'm okay with either version, and I appreciate everyone's work and effort on this. Thank you.
Sounds good. Does anyone else have anything to contribute? David, go ahead.
In my opening comments, I said there were some I wasn't a fan of, and I think you guys kind of worked through that, and so I think, like Dwayne said, I'm fine with it, but I kind of want to echo Ashley's comments that singling out single industries, the virus doesn't know where it's at, and if it's in a household or in a business or in a church, like, it doesn't know where it is, so everybody needs to do their part. So to pass ordinances that single out specific industries or businesses, if your goal is to really stop the spread, everybody needs to play a part, like at every level in households, businesses, everybody. So as you continue to legislate on this, just be careful that it doesn't know if it's at
Right.
my house or your house or a business. So
I think that also brings up another really good point, that a vast majority of preventing the spread of this illness falls on the individuals that will be traveling to these restaurants and bars and entertainment centers and so forth. And a bar owner, a restaurant owner, or the owner of a grocery store can only be so responsible for the behavior of the people that enter their stores to a reasonable level. And so we're trying to create some guidelines that'll at least help them make responsible decisions, but ultimately the people of this community have done a very good job with that from what I've been able to experience, and I expect that will continue to be the case regardless of whether or not these bar owners have to wash their hands every time that they touch anything. So I guess with that, if no one else has anything to add, we'll...
Yep. Like, Tom, do you want to talk through bullet point D?
Yeah,
Okay.
actually, and I just had a minor reference for the employee screening. I think we just blanketly referred to CDC. If you actually look at the link on the South Dakota Governor's Plan website for that, though, it takes you to a link on the southdakota.gov site with a specific list of things to ask for. And the two references to that are a CDC link and a NIOSH link. So I think, Ashley, we were talking about either adding NIOSH to that, or you had a suggestion of removing that might be covered under.
Perhaps we could just
paragraph.
leave it higher level that they have to. I have a point to make based on some correspondence that I have had prior to this meeting, that the Avera St. Luke's Foundation has offered to provide a number of thermometers to help in local businesses doing their employee screening. And so those will be available soon through the foundation. And those, in the foundation itself will be working to produce a document that will summarize the guidance provided in these lists. So I think that that'll be a good resource for businesses that don't otherwise have access to thermometers. I know they've been a little bit hard to come by, but a majority of the screening is questions being asked about people's well-being. That's my understanding. So,
I think, Mayor, what we're suggesting in bullet point D is the council to consider removing the language CDC and or adding South Dakota Department of Health.
It's in actually an I.
Or I, yep, there you go.
We pulled that across from E of the other. So currently it should read, to my knowledge, implement daily screenings protocol per CDC guidelines for all employee. Would your recommendation be to strip that and then obviously give the guidance of people to do that, or to...
Did you say South Dakota Health?
Yeah, just to add South Dakota Health, I think she was.
Get rid of
either-
CDC and add South Dakota Health.
Yeah.
Sounds good. Can
I'll
I get a
make that
motion
motion.
to replace the term per CDC and replace
Second.
it with South Dakota Health? And that was Bunceness, and a second from Rux. Does anyone have any dispute about that or any questions? Otherwise, Carl, give me a vote on that amendment to bullet I. Is it-
Councilmember Rux?
Aye.
Olson?
Aye.
Bunceness?
Aye.
Johnson?
Aye.
Reif?
Aye.
Lunsman?
Aye.
Remily? Excuse me, Ronnie.
What's that?
Ronayne.
Aye.
Remley.
Aye.
Mayor Shonneman.
Aye, motion has carried. That recommendation has been made. Thank you very much. I appreciate the input on that. Are there other points from anyone to, on behalf of the this resolution that we'll be voting on here momentarily?
I promise this is my last one, but I think as a
Carl, hit
council,
the mute button quick.
yeah, I just want the council to maybe have Ron or Lynn pull it back up, but I want you guys to look at your current ordinance, section A7, paragraph A. I'm a little confused of what it's referring back to paragraph 1, and so I think if you can pull that up.
Did you say 8?
She's at 7.
7A.
Is this it? Are you looking at it?
Yep.
So that was exceptions to the first paragraphs that insisted that these places be closed. Is that correct, Ron?
Right, these identified businesses were not ordered to be prohibited or closed by that.
But Ron, correct me if I'm wrong, as I'm reading this though, it's saying that these businesses here aren't closed, but yet they're subject to requirement paragraph 1. So if you can scroll up to paragraph 1, I'm reading it as these businesses are only doing takeout only.
That's to the extent that they're doing off-site or on-site consumption of food and beverages for on-site consumption, then they would, I'm sorry, let me.
So that's a good point. So do we need to strip out that part that refers to paragraph 1? Paragraph 1 will be replaced when this goes into effect?
I see what you're saying.
So I think if you guys plan to extend 7, I just wanted you guys to highlight that and have a discussion on either revising 7 or just being cautious what that's actually telling the public.
So let's look at the paragraph that says, now therefore be it resolved, Ron, on the new proposal that refers back to that. Let's just get clarity on what exactly we're doing with this new.
Yeah, I'll have to do that again. I think it requires me to click out again and go into it. Share screen. Is this what you're talking about, Mayor?
Well, I'm asking, so what is it, I hereby extend, so I guess it would be the second paragraph. This is the part that gives this new resolution teeth and squeezes it into the original ordinance.
I think we need to deal with 7. Because it's only dealing with paragraph 1 through 5. Removing the terminology of closing and.
So if I'm understanding what is being said here, and we could clear that up if I later find out that that's not correct, but we could include in paragraph 2 here of the paragraphs, we would also include number 7.
Right.
Mr. Mayor, if I might. I think it's all spelled out here. If you read number 2 under the Ronayne proposal, it says the city council hereby extends paragraph 1, 2, 3, 4, and 5 of section A of the emergency ordinance for the day, yada, yada, except that part of each paragraph that prohibits or closes on-site consumption sales.
Oh, yeah.
So I think that specifically excludes what it says in there, if I read that correctly.
That's right.
Is that only dealing with paragraph 1 through 5?
Yes.
And when we get to bullet point number 7, it says we extend 6 and 7.
But is 7 not relevant because it's referring back to something that's been excluded here.
Right.
Okay.
It's going
Yeah, okay.
around and around and around. You got to get it
Okay. Yep.
somewhere along the line.
Okay.
It does. If I can chime in, I understand Ashley has caught the fact that this is circular and that we should probably make it clear, though, by including in paragraph 2 here, 1, 2, 3, 4, 5, and 7, because this portion, the portion of 7 that doesn't apply unless you're dealing with on-site consumption, and then it does apply. So I do think we should make that change and add in 7 and number 2. And then we could delete 7 here in paragraph 7.
So moved.
Second.
I've got a motion from Ronayne and a second from Councilman Bunceness to add the numeral 7 to paragraph 2 of the resolution and to eliminate the numeral 7 from paragraph 7. Does anyone have any objection to that, or else I will have Carl take a roll call vote, please.
Mayor, just for cleaning it up, you're going to want to address section B of your current ordinance then.
Thank you.
Yep, it's just the numbering would overflow if I'm reading it right, Ron. So not on this,
7 of section.
it says all of section B,
I
but
think
now it's
section,
in,
is section B referring to this entire document?
No, section B deals with the repeal type provision, so it's not, we would not need to include or make any change regarding this. So the change that you're making is sufficient and appropriate.
Ashley, thanks for scouting that stuff out for us.
Mayor,
Carl?
this is a quick audio visual. I know we're getting close to the finish line here, but I'm getting input from people who are on Zoom and out in the public watching on TV that they can't hear well. So just a reminder to be close in to the microphone so people can follow the proceedings. Thanks.
Our ears are still hurting from Monday, so we don't want to get too close. So do we need a vote on?
Yep.
Okay.
Carl, vote on removing 7, adding 7 to the respective paragraphs mentioned.
Councilmember Remley,
Aye.
Ronayne,
Aye.
Lunsman,
Aye.
Rife,
Aye.
Johnson,
Aye.
Bunceness,
Aye.
Olson,
Aye.
Rux,
Aye.
Mayor Shoneman.
Aye, motion does carry. Any other input from anyone as it relates to any of these items on proposal number 2? Otherwise, we will take a motion to, I guess we've got a motion, Ronayne, second Rux. Let's take a vote on resolution number 2. Carl, give me a roll call vote, please.
Councilmember Rux,
Aye.
Olson,
Aye.
Bunceness,
Aye.
Johnson,
Aye.
Rife,
Aye.
Lunsman,
Aye.
Ronayne,
Aye.
Remley,
Aye.
Mayor Shoneman.
Aye, motion does carry. That has been, and that settles us up for the entire ordinance, is that correct?
Correct.
The way I have it.
Sounds good.
But I
I don't think we've got anything else in the agenda here tonight.
Move to adjourn.
Second
Well,
that.
Mr. Mayor, excuse me, everybody. I had one thing I wanted to ask Mr. Mayor to clarify. Saturday is a special meeting that's, we had noticed for 2 o'clock, but we need to actually have the mayor call that for 2:30 on Saturday.
I will indeed call a special city council meeting on Saturday for 2:30 p.m. to appoint a new city manager and further discuss this resolution to extend it.
Mayor, I think the other item is whether we're going to be doing that by Zoom or we're going to be in the chambers.
For the interviews?
Yeah.
So when we come together, are we going to do that Zoom like we've been doing, or are we going to not social distance in the council chambers? I think we use Zoom, in my opinion, but, so we would leave the facility because we have individual
Interviews here.
Yeah, and so you'd have to go home and get on Zoom. But, and so we need to come up with a decision here.
Well, since we're just doing interviews, could we just, we don't all have to sit up here, correct?
Right, that's
True.
a good point.
That's
We
true.
could spread out and we could have a person further out and set up a table further out so you could have council member here and still maintain, council members here and still maintain social
Yeah,
distance.
Jill Moore sent out a Zoom meeting today, assuming that we were going to continue with that policy.
For the interviews
Yeah.
itself or for this?
Just for this thing at 2:30.
Because this is all right, this is not the interviews itself.
Oh, this is the
Particularly
decision,
in the-
but just before that, when we have the total interview, she
maybe-
sent out a Zoom meeting, so we can do it here.
Yeah, I think we could find
Yeah,
a space.
It's key to do it here.
Move to adjourn.
Second.
I've got a motion from Bunceness and a second from Johnson to adjourn this meeting. Carl, give me a roll call vote, please.
Councilmember Remley,
Aye.
Ronayne,
Aye.
Lunsman,
Aye.
Reif,
Aye.
Johnson,
Aye.
Bunceness,
Aye.
Olson,
Aye.
Rux,
Aye.
Mayor Shonneman.
Aye, motion does carry, and we are adjourned.